Very good morning to everyone. Good morning, everyone, and good morning to the interpreter specifically. So we're going to start today with this round, with this press conference. And well, I first want to thank you. I'd like to thank all the media outlets and journalists here in the room today, and also those of you who connected online. It is my honor to be here with the chair of FIP, Mr. Dominique Jordan, and the vice president of FIP, Lars Aki. My apologies for mispronouncing probably your names. Thank you very much, Dominique and Lars, for coming to Spain today to share this moment with us. It is an honor to have you here today. We're super proud. The goal of this press release is to present to you the great date for pharmacists. Finally, it's going to take place in 2022. It's the 80th World Congress of Pharmacy and Pharma Sciences and the 22nd National Pharmacy Congress. Both events will take place from September 18th to 22nd, year 2022 in Seville. As you know, you have all the information available on our website, and we are expecting over 5,000 pharmacists and professionals from the world over. Through 5 days, we will talk about the role of the pharmacists during the pandemic and how we have contributed to the efficiency and efficacy of healthcare systems. As you all know, this date was postponed for 2 years. We are arriving 2 years late to Seville, but that has only made us all the stronger and excited to be there. Once again, I want to thank our chair, because, as you know, as the World Congresses are picked and put in the calendar, we work many years in advance, and they've been able to save this slot for us to keep the Congress in Seville. Thank you very much. And I want to say that this group of healthcare professionals in Spain and around the world have played a key role to successfully overcome the greatest healthcare crisis of the century. With no exception, we have all experienced it. The world today is very different from the world 2 years ago. But we have assumed our collective vulnerability thanks to our humanity. Only science, research, and drugs have enabled us to overcome this emergency. And this emergency has also shown that healthcare systems must be strengthened. We must learn that lesson, and that is at the core of the program for both Congresses. We must learn that lesson. In the case of FIP, our International Congress, and Dominique will share more information about that in a minute, the motto and the program have been reshaped for this. For the National Congress, the motto is the same that we started on our national strategy 2 years ago. We are pharmacists, we are caregivers, we're social, and we're digital. Our strategy actually, well, it's like we had the crystal ball, you will agree. But thanks to that strategy, we've been able to prepare for the pandemic better. Now, regarding the program, I want to highlight that there will be first-rate speakers, around 11 roundtables, 4 sessions on innovation and 25 professional tables. And we will talk about professional matters. There will be a table or talking about collaboration across pharmacists across different care levels. And I'm talking about community and hospital pharmacists collaborating to reduce the pressure of patients on the hospitals. That has been a large success during the pandemic. Thanks to this collaboration, there's been access to drugs normally dispensed through hospitals through pharmacists, normally guaranteeing the custody over the drugs, the pharmacist custody, and ensuring continuity of care for patients. This collaboration has been essential for the healthcare system and for patients, and it remains active today, as it couldn't be otherwise. There are 69 hospital pharmacy services, over 6,000 pharmacists, 19 distribution warehouses working together in sync for the benefit of 31,000 plus patients. To date, they have received close to 200,000 pills. Healthcare will be another key theme during our Congress. We must prepare our healthcare system to respond quickly to future healthcare crises, having all the resources and the ability to provide care ready. And I must remind everyone that the role of community pharmacists by evaluating, notifying of positive cases through the antigen self-diagnosis test is enabling primary healthcare centers they're removing a lot of workload from them. Only in Q1 2022, the pharmacists oversaw over 600,000 tests, and they notified to the national healthcare system or 82,000 positive cases. That's 6+% of the tests carried out. Digitalization of the work of pharmacists will be another theme, very important one that we will discuss in Seville. Pharmacists are not only coexisting in an innovative society. We want to be a lever for change. We want to be part of the digital transformation of healthcare. We do a lot. We do the digital prescriptions for the public healthcare system, for mutualities, and for private insurance companies. And we've done so through the pandemic to provide drugs to patients and reduce risk. And the verification is integrated within the Spanish verification system. And thanks to that, over more than 3 years now, since February 2019, the drug companies and the pharmacists have been able to meet the European guideline to prevent falsified drugs coming into the distribution chain. The labs, the distribution chain, the 22,000 plus community pharmacies in Spain and all private hospitals are complying with the verification as per the European directive transposed in February 2019. This is part of the digitalization that connects pharmacists to help patients find their drug when there's a shortage of supply or any incidents. In Seville, we will talk about pharmacy care at home, career development for pharmacists, or the portfolio of caregiving pharmacist services. And in the sessions, we will talk, for example, about the therapeutical use of cannabis. It is a very hot topic, and Spanish pharmacies, as you all know, have made a specific proposal to Congress in Spain. They want to do a pilot in Spanish pharmacists with top guarantee of quality and security in coordination with doctors. We want this event to take place soon. We are very excited. We're working hard towards it, and we're very excited and passionate about it. And we encourage all pharmacists to be part of this event. And we encourage everyone to present their communications to the national and the international congresses. And the best communications will be selected from the group. 3 of them will receive an economic reward. But beyond the scientific program, we want this National Congress to be a place where all pharmacists can gather. And for that, we will have students present. And for the most part, students will be in charge of the organization because we are, well, in touch with them, and we are liaising with the schools of pharmacy and the FED to leverage all synergies. And I'm coming to the end of my remarks. I will say that Seville is an extraordinary event, and we can show the world the job that we do with it. We're going to do it. We're going to make it, because the end of the pandemic won't be the end for us. It will be the starting point down the new journey, assuming new challenges and creating new services for the benefit of patients and healthcare systems. The time has come to continue to guarantee the best healthcare. And for that, pharmacists and pharmacies are a key asset. We're going to prove our value to society, and we're going to learn what our colleagues elsewhere in other countries are doing in this journey to provide pharmacy services. And I want to encourage everyone to attend in this great event. Delegates from all over the world and Spain, please do come to Seville. You want to see the future that we will be projecting in Seville firsthand. And to close the circle, I want to thank you once again, the journalists and the outlets here today. You are always there, helping us spread our messages. You're a witness to our work, and you've been there with us during the hardest times of the pandemic. I'll give the floor now to the chairman of FIP, Dominique. He will be presenting the program of the Congress. Thank you.
Thank you, Mr. President. Good morning, everybody. First of all, I'd like to say how pleased I am to be here at this briefing about the Spanish National Pharmaceutical Congress and the 80th World Congress of Pharmacy and Pharmaceutical Sciences, which will both take place in Seville this coming September. This meeting signifies that we are finally beginning to emerge from the COVID-19 pandemic. We are all aware of the massive global challenges presented by the new coronavirus and its variants that have changed our lives and work. You may know that before the pandemic, the FIP World Congress was an annual event co-hosted with a FIP member organization in a different country each year. This Congress brought together pharmacists, pharmaceutical scientists, and pharmacy educators from across the globe to share the latest development in the profession and foster cooperation. And since FIP's establishment in 1912, only the First and Second World Wars had previously suspended our Congress activities. The global health emergency of COVID-19, however, meant that our plans for a 2020 Congress in Seville had to be postponed. And I would like to thank our colleagues at the General Pharmaceutical Council of Spain for their strong and enduring partnership and collaboration over the past 2 years, as we have monitored the evolving impact of COVID-19 around the world in order to make the best decision together. Our 2020 Congress title was Technological Revolution, Impact on Pharmacy and Healthcare. But COVID-19 has itself been a revolution, presenting our pharmaceutical profession with extraordinary opportunities to demonstrate its value. Our profession's steadfast dedication to serving our communities during the pandemic has proven that pharmacists and pharmacies are integral to a well-functioning healthcare system. And we have seen our profession advance at an unprecedented rate, expanding the scope of our activities to provide more services, including testing and administering vaccines. Importantly, the experiences and evidence related to such advances must be shared so that countries can learn from each other. COVID-19 has also opened our eyes to the vulnerabilities of our health workforce, weaknesses in our health systems, the importance of tackling inequity of access to medicines and vaccines, and how vital it is for us to work together to find solutions to increasingly global problems. Furthermore, we know that the burden of the pandemic has pushed us, of course, with the United Nations Sustainable Development Goals, and we must work together, not only against the pandemic, but in building back healthcare. We must be united in contributing to these global goals. For these reasons, the overarching theme of FIP's 80th World Congress has been revised and is now Pharmacy United in the Recovering of Healthcare. In addition to plenary sessions under this theme, presentations are offered under 3 tracks. The first track is learnings for future preparedness. At this critical time, when the challenges presented by the COVID-19 pandemic are still current and on the minds of healthcare professionals, we must take the opportunity to create more comprehensive plans to better manage health crises that may be on the horizon. COVID-19 brought to center stage the importance of pharmaceutical science and the hope it carries. Without pharmaceutical scientists, we would not have the vaccines or treatments we have today. Track 2 of the Congress program will focus on the science and evidence supporting the response to COVID-19, and participants will hear from experts on a range of topics, including new medicines and vaccine technologies, improving communication and addressing misinformation and strategies to support all-person healthcare pharmacists' new role. The third Congress track is dealing with new and extraordinary ethical challenges. In Seville, we will explore solutions to health inequities and inequalities, medicine shortages, access to vaccines and treatments, choices and affordability and sustainability, including solutions presented by technological advances and artificial intelligence. Expertise on topics such as long COVID and leadership in times of crisis will also be shared. I hope I have explained well enough in the short time available the importance and high relevance of our 2022 Congress theme, and it is extremely fitting that this event, which will bring the pharmacy profession and pharmacy leaders face to face again after a gap of 2 years, is to be held in Spain, a country that is a leading example internationally for its achievement in advancing pharmacy both before and during COVID. We commend the many developments in Spain, such as collaboration between hospital and community sectors to improve access to hospital medicines, a role in testing and reporting of results, electronic prescriptions, and an extended social dimension for pharmacists caring for the most vulnerable in our communities, including patients with chronic diseases who live alone, providing vulnerable groups with their medicines at home in collaboration with the Red Cross, and even under the MAS 19 initiative, caring for women who feel physically, psychologically, and sexually threatened. Never have so many governments, country leaders, and ministers acknowledged the contribution of pharmacy to health systems and the health of communities as in the past 2 years. FRP was delighted that earlier this month, our profession in Spain has been recognized for its dedication to service and professionalism during the first month of pandemic with the country's highest civil honor, the Grand Cross of the Civil Order of Health, which the General Pharmaceutical Council of Spain received from the Ministry of Health. This award recognized in particular Spanish pharmacists' work in the supply of vaccines, as well as their contribution to the COVID-19 vaccination campaign. No single event has demonstrated the value of pharmacy as much as COVID-19 has, and doors to new and expanded roles have been opened. We must grasp the opportunities available, and we saw a great example of this last year when the General Pharmaceutical Council of Spain used the occasion of the World Pharmacist Day to meet with the Congress of Deputies, where my fellow President Jesús Aguilar presented 10 proposals of the pharmaceutical profession to the present and future challenges of the country's national health system, and further advocate pharmacists' commitment. The proposals of the profession in Spain include an agreed portfolio of professional pharmaceutical services from community pharmacy to strengthen primary care. And this aligns with the work of FIP under its commitment to the Astana Declaration, which aims to refocus efforts on primary healthcare to ensure that everyone, everywhere, is able to enjoy the highest possible attainable standard of health. We were pleased to hear Dominique Jordan, the President of the Congress of Deputies, speak of the well-deserved reputation of pharmacists as a result of years and generations of caring with expertise and professionalism, and referring to our profession in Spain as an asset to Spanish society. In particular, Mrs. Batet complimented the General Pharmaceutical Council's strength and capacity for dialogue. She encouraged Parliament to consider the needs of the pharmaceutical profession in order to protect the vast pharmacy network as an asset to the health system, and acknowledged the potential for an advanced role in public health. This Congress is a very important opportunity to bring FIP closer to Spanish pharmacists and to demonstrate what we, as an international professional organization, can do for the global transformation of the profession. The pandemic remains a global crisis, but we are not now better equipped with knowledge, evidence, vaccines, treatments, and strategies compared with where we were at this time 2 years ago. We must be proud of the contributions that our profession has made to get us here, and we are now at a stage where we have good evidence to share, reflect on, and use Transform Pharmacy globally so that we are fully equipped to contribute to the present and future challenges of health systems. I look forward to seeing many of my colleagues again on the 18th of September after a gap of 2 long years, and I know that many members of our global pharmacy family feel the same. I invite colleagues around the world to join us in ensuring that pharmacy emerges from this pandemic bigger and better, and in shaping our future actions so that the pharmaceutical care that we provide results in the best outcomes for the health of our populations. Thank you very much for your attention.
Okay, so we now remain fully available to you for any questions that you might have. Mike, please.
No, no, sí, no, no, no. Ah, no, sí, ponlo por los de fuera, sí. Pues el de al lado. A ver.
So you're talking about 5,000 pharmacists in Seville. How many will be coming from abroad? How many will be Spaniards? And then how are you going to encourage sign-ups? How many have signed up already at this point? Thank you.
Bueno, la última pregunta no te la sé
Well,
contestar.
that last question I actually cannot tell you. I don't know how many have signed up already, but how are we going to encourage people to register? Well, we're going to communicate as we're doing right now. We will get in touch with national associations and with you, journalists. And this is a world congress. And well, world congresses can be, they're big and complicated, and the General Council is making a financial effort to make sure that fees are affordable for everyone. And we can attract as many pharmacists as possible. And then to your first question, I expect some 3,500 delegates from abroad and 1,500 from Spain. More questions?
Good morning, Mr. Jordan. I am Antonio Mingaro. I am editor-in-chief of a digital health small newspaper called Sanifax. It's nice to meet you. It's a pleasure being here yesterday and today.
My pleasure.
I have a question for you, please, and a question for Mr. Aguilar. The question for you is, I write in English, and my English is not very well. What would you say are the great challenges of the global pharmacy, and what would you say are the strongest virtues of Spanish pharmacy to export to the global pharmacy, and also the opposite? What are the strongest virtues of global pharmacy able to export to the Spanish pharmacy? Y para Jesús Aguilar, quería saber cuál es el apoyo. Ayer estuvieron con la ministra de Sanidad. No sé si hay alguna noticia que le comentó que nos pudiera trasladar, yo lo pregunto por si acaso. Y sobre todo, ¿cuál ha sido la acogida en un país como España, en el que uno se tiene que pelear con las autoridades locales, regionales, nacionales y en este caso mundiales? ¿Cuál ha sido la acogida del gobierno español y si tendremos a la ministra en la inauguración o incluso, ¿por qué no?, al presidente del gobierno? Gracias.
So thank you very much. It's also my pleasure to meet you. And to answer your question, what is a lesson that we can get from the COVID-19 pandemic is nothing can be solved locally. We have to think globally. And this was, you know, what is happening now in China with the zero contamination. And other countries, like, for example, in Switzerland, my country, we have no mask, nothing anymore. And one countries are vaccinated, the other one not. 2 vaccine, booster, not booster, wrong vaccine or not. Good. And this is a problem. If everybody try to do something in his region, we will have big trouble in the future, not only for COVID-19, but also diabetes, non-communicable disease. It's a global issue coming from different parts of the world. And it's a reason why FIP is pleased to have so many member organizations from about 150 countries, because the problem are the same, but the solution are not maybe not the same, because we have some political particularity, we have environment, we have different remuneration, and so on, that allow us to find solution in putting the people in contact. FYP is like a platform, having country with skills, other one with needs. And the strength of FYP is to put them together and maybe to let them work on a project to be implemented in the country. The second part of the question, what could Spain bring to FYP? With the connection that you have traditionally with South America, it's a good example how we can combine the skills that the Spanish pharmacists developed during the years and try to bring that to some countries in South America. In the contrary, we have some good example also from other countries in Asia on having some interesting digital tools that could be imported in Spain or in Europe or in other parts of the world. And this is the added value of FYP for the member organization, having this possibility to first to know what for innovative projects are developed in other parts of the world, and secondly, to have some communication with them and maybe to not reinvent the wheel and to get some project, adapted the project and implement that in the region for the benefit of the profession, but also for the benefit of the population. And this is always the goal. It's responded.
Okay, and then regarding your second question, yesterday was a great meeting. We have the support of the minister, the government. The minister will attend the inauguration of the Congress, and probably she will be present at some other point during the Congress. The honorary chair will be His Majesty the King, and we have invited him to the inauguration as well. But we do not have confirmation on the attendance yet. And then in June, Dominique will come back to Spain. We will visit Seville, and we will meet with local regional authorities in Andalusia. And of course, we've met with them already a few times, and we've already closed on many points with the local and regional government. In any case, we have the full support of the minister and her team. She understands it is going to be a great event. She highlighted the role of pharmacists through the pandemic. And she's made herself available to us to make sure that this event is very successful. More questions, please?
I was outside of and involved in the meeting, and I was quite impressed about the good relationship between the Consejo and the President and the Ministry of Health. I have been 12 years president of a national organization in my country, and I know how difficult it is to have this relationship, especially if the people are moving and changing, because you always have to begin again to explain to them the strategy and so on. And the mood during the meeting was really convenient. And I had some other meeting with Ministry of Health with another kind of mood, I have to say, just as a observation outside of the political environment of Spain.
Bueno, ¿más preguntas?
I do have a couple of questions for Mr. Jordan. First, I would like to know what role will vaccination against new variants play? And the fourth jab, will you discuss this during the Congress? And will there be a talk regarding a shared guideline for all countries? And then a question regarding Spain. What's your opinion about the cannabis strategy taken to Congress? And also, do you believe Spanish pharmacists should provide the jab against COVID, just to compare with the situation with other countries? Thank you.
Thank you for your question. The role of FIP in sharing information about vaccination and the fourth or the second booster is, of course, very important, and we'll discuss that during our Congress. You have to keep in mind that this is a country-wise decision afterwards. For example, in Switzerland, we don't have any information about the fourth vaccination for older people after 65. Other country, Ireland, I think, get the permission to vaccinate these people yesterday. And depending also of the number of cases in the country and the hospitalization and the experience they had during the COVID-19, each country will adapt the strategy that they have. One thing is very difficult to manage in the pharmacy is the question of the people coming to us and asking the professional, but what's about this vaccine? For vaccination, is this really a good vaccine? Why do we have to make so much vaccination to be covered? And this is a little bit quite a challenge for us in the front as a pharmacist to convince the people, yes, it's because you are vulnerable, and it's a reason why you need a fourth one. And to answer your question, will be part of the discussion in Seville, and we will have a statement about that probably after Seville. The second, cannabis. Cannabis is not a scientific issue. It's a political issue, economical issue. We have to be clear about that. We have many countries having a pilot project. France, Switzerland, Portugal, and so on. You begun now in Spain. It's always difficult for pharmacists to decide. We had 2 years ago a survey in Switzerland asking the pharmacists, are you in favor or against to participate to the pilot project? And a lot of pharmacists were again. Other one, they said, yes, it's progressive. If it's for the benefit of the patient, I want to be part of this innovative therapy. But you have to see that it takes time for pharmacists to do this job. And always is the same. We can do every services for free. And who will pay that? How much will be the pharmacist paid for that? Because at the end of the year, we have to pay salary and infrastructure. And this is always in all the countries, it's coming. A pilot project for free, yes, but afterwards, no more, because I have some costs and I want to be reimbursed for my costs. And this is a little bit the situation that we have worldwide, or in Uruguay, they have also this pilot project and so on. It's answered?
Any more questions? Hello, good morning. There are regional elections in Andalusia on June. Will that organize in any way your Congress? You're in touch with the regional government in Andalusia, but it might change. Well, we are in touch with the regional government, which is governed by the Rights Party, and the city council is the left-wing party. So we're in contact with both, so we're not concerned. In any of the sessions, will you talk about the reform in Andalusia? No, it is a national congress, and regional matters are part of regional congresses. Therefore, regional regulation is out of scope. I don't think it's something that should be discussed nationally. It should be discussed by the parties involved. Well, you know that the auctions are a pending matter in Andalusia. Well, the rule is one thing, but in this case, we're talking about the modification of an article that was modified. In the sessions last week, there was a commitment to implement this law if they win the elections. Now we'll need to see what's the position of the other candidates. No more questions? Yes. From our very own. Okay. These are the questions from the chat. Right, so he's a spokesperson for all of our journalists outside. Andrea Joseph from Argentina, from the Argentinian Confederation. She has a question for each of you. Maybe in the near future, given healthcare requirements, governments will need to recognize pharmacists as a public healthcare system. Is there any work being done right now to have a harmonized portfolio, maybe per regions in the world? And then what is the 2030 strategy, and what would be the professional services provided? I have more questions after that.
Of course, we're working on the recognition of the pharmacists as part of the health system and medical person. Long time ago, we are involved as pharmacists in the statistic as a business unit because of the medicines. But it was 30 years ago when the pharmacist has no recognized services. The evolution of the profession is like this now, that we have more and more services to provide for the patient. I don't take only vaccination, but we have also the testing in the pharmacy and screening, and we have also some services pro country. In Switzerland, we have Netcare. It's like a consultation from the pharmacist for example, bladder infection, and we can solve the problem giving the people antibiotic for 3 days and calling them afterwards after 3 days to see if everything is good or not, if they need a consultation by the doctors. It's more collaborative service with the doctors, so that the definition of the role of the pharmacist has been extended, so that we are more now on side of a healthcare system than business. And we are working on it with the WHO and with the United Nations to change that also in the statistic. We could within a FIP discuss with a different region. We have the forums. How can we move forward quicker and having this on the calendar, so to find solution and have a domino effect afterwards. When one region accept that, it's easy afterwards to have the other region accepting that the fact that the pharmacists are now provider. Concerning the services, I say we don't have any country to, how can I explain that? It's a political issue. We have no country that we can say this is the best country for the pharmacy profession, because the environment, the political issue, the economic issue is so different in different parts of the world, even in Europe. So we can say in this country will be good if the pharmacists could administrate vaccines, because it's a lack of vaccination. We have a vaccination rate very low, and the contribution of the pharmacists will be good. But this is not automatically the response that another country in Europe expect. It's a reason why every services that we developed as pharmacists or as national association has to fit in the strategy of the national organization. And it's the reason why in FIP we are very prudent, and we say, you decide your strategy and we support you in this strategy. But it's not FIP who will come and say, hey, in Spain, you have to implement vaccination. No, what's your need? We are here with you. We can support you. And this is very important, that the services are adapted to the expectations of the health systems, of the population, and also the very fragile balance between the relation, in the relation between the stakeholders. It's a reason why we are there to support our member organization, but the member organization are decided the strategy. It's very important for us in FIP. It's okay.
Okay, well, first, my greetings to outlets in Argentina. Thank you very much for joining us. Now, what's the 2030 portfolio? Well, this is very long. I do recommend you come to Seville. We will explain this to you in a lot of detail. In any case, we've put around the same table all organizations worldwide that work on primary pharmacists, community hospital pharmacists, distributors, co-ops, and we are designing the plan 2030. This plan will be officially presented in the National Congress, and it will very clearly mark the rules of the game to have a portfolio of services that is harmonized at country level. Particularly, you know, we have 17 regions with lots of variety within. So this plan is created not just by the General Council. We are leading the plan with all the organizations in the world of pharmacy.
No, ponte, ¿te oye? No, ponte, ¿te oye? Mira. Antonio sí que tiene huella. Antonio sí que tiene huella. Tú no tienes ni huella.
Okay, we're not doing great on time, and I think we've addressed all the questions, but there's still a question from Portugal. Sonia says, all countries must have rethought their healthcare systems, new strategies to respond to new needs. In Portugal, the pharmacists were on the front lines of the pandemic. What are the lessons learned? How have pharmacists contributed? How were they prepared? And second, what are the conditions to continue to expand the role of pharmacists around the world? Dominique, please.
Good. Hello, Sonia. Thank you for your question. We have a lot of lesson learned about this pandemic. And if you can remember, in 2020, I was in my pharmacy without protection, without mask. The most of the offices from the doctor was closed and the patient were in my pharmacy, and I had to deal with them. And this kind of a surprise, having nothing, no instruction of the government, because we had no mask. The masks were reserved for the hospital. We have no disinfection disinfection gel for the hands. We had to compound that first, and it was a lack of 1-2 months until we could say now we have the measures that we need as a stakeholder being in front of the pandemic. Now we are prepared. We have some stock in the pharmacy. We have 10,000 masks for our use in the pharmacy. We have a disinfection gel in reserve. We have also the habit to deal with the patient. The patient have the habit to come in the pharmacy, and it's a trust between the pharmacists and the population, thanks to the pandemic. And what is important is also that every time when the government has a task force, that the pharmacists are involved, and not only community pharmacists or hospital pharmacists, but also community pharmacists, because I know the most of the problem for the government was the hospitalization, and they had fears, and this was okay, that all the system, the hospital system will fail. And it's a reason why all the measures of the government with the lockdown and so were because of the hospital. But now we have to be involved also to tell them what we need as a community pharmacist, and what is important. Communication, for example, because in each country it happens the same. The government communicates something on Friday, and on Saturday, on Monday, they were in the pharmacy and said, "Hey, stop it! We are not ready to do that testing or different things that we have to manage in the pharmacy." So that communication, being involved in the government decision, it's very important. When I consider the FIP activity, we developed the most comprehensive COVID-19 hub. I don't know if you went to the homepage of FIP. You have a hub with a lot of information about what we should do during the COVID-19, the development of the measures, and what some countries did, what we did in FIP. Just to tell you, within 3 weeks, we organized a task force in FIP with a representative from China, from over the world, experts, and we developed some measures for pharmacists, for community pharmacists, to help them. And this is very comprehensive and very used also all over the world. And what is very important is that the pharmacist is able to have the right information, because during this COVID-19 pandemic, I had some story to explain in my pharmacy. During the vaccination, I had to go outside to take the QR code for the people, and I saw the girl doing like this with a spoon. I asked her, "What are you doing?" "Yeah, I verifying if some magnet has been implemented in my body." I said, "Stop it! It's ridiculous." And this is kind of misinformation, and we have to deal with that. And FIP was really scientific based and clear about what is wrong, what we don't know, and what we can communicate to the patient. And I think this is a very important thing for the future, that we are ready for that, and that we can support the people, support the government, support the health system in the best way.
Well, Sonia, it's been a pleasure to read your comments, and hopefully we'll see each other soon.
muy pronto, ¿no? Mira, yo, con respecto
Now, regarding the question about what we've learned,
preguntas de qué hemos aprendido,
I would summarize it across 5 points.
lo resumo en 5 cosas. Yo creo que hemos aprendido que toda la
Society
sociedad
as a whole has learned that
la farmacia
pharmacy is a
conquista social del
social
una conquista social.
win for citizens.
Es una conquista social.
And always during the pandemic,
Durante toda esta
the
pandemia,
green lights have been on,
esa luz verde de la farmacia,
and they will remain on.
que siempre seguirá encendida.
And third,
Que tenemos
we have the recognition of all citizens, and we've seen this in the surveys in this country. And fourth, we are the solution, and I believe public administrations are realizing that we are part of the solution to the problems of the healthcare system, and we can contribute a lot to the healthcare system. And fifth, we've learned there are processes that need improvement. We've seen there are digital technological processes that need improvement, and we've seen that they can be enhanced during the pandemic. We've also seen the potential of care projects, and well, there have been different protocols to implement them on pharmacists more easily. My name is Daniela from Global, and I have a question. You say that the Congress is going to be a meeting point to kick off new challenges going forward. Now, taking into account the national and international contexts, what new pharmacy services could be implemented nationally, and what are, taking into account the European reference, what should we bring to Spain for the benefit of patients? Dominique, you want to take it?
It's more your business, Spain.
Well, I don't think we're going to be discovering services.
Lo que tenemos, yo creo que aquí tenemos una función fundamental, ¿no? Este congreso es el congreso.
I think we play a key role. And first of all, I must say that this Congress is when we meet again. That's really important. We're going to see each other again face to face. All professionals who will could meet and discuss matters every year. It has not been so. Well, it's almost been 3 years. This hiatus has been 3 year long. So it's about meeting each other again, putting on the table our experiences over these 2 years. Sometimes in many fields, we want to go very quickly. But we're talking about health. And we're saying that progress in healthcare and pharmacy must be consolidated as what we always try to do in pharmacy. And this development of new ideas and projects must be good for citizens. But it's not about creating new services for the sake of doing that. We're pharmacists. We're not doctors. We're not nurses. Don't be mistaken. We have our job to do, and we are prepared for certain things. It's not about coming up with systems and things. But all of our experience across the many countries, first we need to learn about them, to analyze them and give them some thought.
If I can add something, it's very useful to have this discussion within the member organization, because we are always discussing about sustainability. And having a service for 1 year, it's not good. What we should have is implement the service and then make it sustainable. And it's a reason why I come back with a remuneration for the services or for paying the pharmacist for the job he's doing. Because at the end, if the new service is good for the population, it has to be paid. If it's not good, the pharmacist has to stop it because it's no interest for the health system and for the population. And this discussion with the different country allows maybe some remuneration model for typical services to discuss afterward with the government in Spain or in other countries. And these are very fruitful exchanges, allowing the profession to go further in the right direction for the country. What I want also to say concerning FIP, we created the development goals, 21 development goals, and this should be a frame for what or how the profession should be developed in the different part of the world globally. I think everybody is agreed with the end point, but every region will have another schedule, depending once again on the political situation, on the economic situation, on the different other issues. But it's important to have the framework so that every pharmacists, educators, and scientists can live in and progress in that framework.
Muy bien.
No more questions?
No hay más preguntas. Bueno, pues.
Okay, well, thank you very much, everyone. There's a video for Seville 2022. So we are going to continue with the Easter week celebrations through September. They look really nice. Okay.
Bueno, muchísimas gracias.
Thank you very much, everyone.
Muchas gracias.